Hey kids, you're about to listen to a comedy podcast. That means that none of this is medical advice. If you need medical advice or medical care, please contact your doctor.
Welcome to the Jock Doc podcast featuring Dr. London Smith. If this is a medical emergency, I hope you have insurance. Introducing your host, Dr. London Smith.
Hello, and welcome to the Jock Doc podcast, where we discuss fitness and health and how to incorporate our modern understanding of science and medicine into our daily lives, but without it being so boring. I'm your host, drlondonsmith.com. I'd like to begin by apologizing to our listeners. We've received some feedback about the excessive amount of technical medical terms that I've been using, such as immunoelectrophoresis and equestrian. So I'll try to temper my terminology to a simpler one in the future. Here to help with that is our producer, Cameron.
Dr. London, have you even looked at the calendar recently?
Yeah, but it's like more for nostalgia. It's my 1983 calendar.
Oh, yeah.
Yeah.
What day do you think it is?
Let's see. It's not. I don't think it's that Thursday, because that Thursday I was supposed to have a massage, and I didn't have one this past Thursday, so I don't think it's that.
It said that on your calendar from the 80s?
Yeah.
Oh, okay.
Was that confusing for you, or?
Yeah, well, just like
from
the
83.
massage you had in the 80s? Like, you said?
Well, I have.
I'm just confused on when the massage was scheduled.
Yeah,
because
the massage was scheduled for the 80s on a Thursday, 1983 on a Thursday.
Okay, but then you were just saying also you didn't do that last Thursday.
You asked when it was. I'm looking at a calendar that says 1983, and I'm ruling out 1983 Thursday because I have not had a massage this past Thursday. So I'm just ruling out this time frame that I'm looking at. So yes, I have looked at a calendar. No, I don't know what day it is.
Oh, this is like Tenet. It's just like Tenet. You know what I mean? Like time.
Yeah, they had to go scuba diving with time breaths, right? Yeah.
Something like that, yeah. But Dr. London, school is right around the corner. You have to start teaching your class next week.
You're going to show up too. Okay.
Yeah. In person this time.
Yeah. Yeah, I was pushing for virtual for so long because I found out I could just get a little puppet going and I could leave and do whatever I wanted. Well, they just kept, learning whatever. I don't know. I start the class by saying, open your books to page 37. Fingers crossed that it's teaching something. Walk out.
And the puppet's just moving by itself, or the puppet's just completely still and they just...
Oh no, I forgot to set up the puppet!
No. The puppet just fell to the floor immediately because, no one was holding it up.
No, I'm realizing that. Okay.
Oh, yeah. Wow, so you did that most of the school year? Well, you have to do way better than that this year, Dr. Lund. You're not going to have that benefit. We got to talk syllabuses. We got to talk, your syllabizes. We've got to talk your field trips. We got to talk about all that stuff. We don't have to do it right now. I'm just saying you're way too relaxed. I'm stressed.
Because, you're the one I put in charge of getting the paper and scissors for them to use for crafts. And that's... Yeah.
Ooh, I don't know how I'm going to do it. I'm running out of time.
I know. So anyway, that's our producer, Cameron, who's obviously very hands-on, dealing with things. But also with us is Did You Know in the House?
Did you know in the house?
And I guess we do have to deal with the school stuff, and everybody hates the going back to school. But before we move on, I would like to address a bit of listener feedback. So, and I guess bear with me a little bit, because you, the listener, our analytics have told us that you are not, when it comes to being able to read or to like figure out how to eat food properly, or I guess writing also, like you can do from the analytics, you can do a few shapes like skull crossbones, trying to think of any other shapes that it said you could do.
Yeah, our analytics said, I think that you can kind of do that little doodle S that people did in like first grade.
The super serum thing?
Yeah, that thing.
Yeah.
So
okay,
our analytics have said, okay, all of your listeners can do that. It's not very good, but they really try their hardest.
Okay. So that's kind of what we're working with. And so just so you're aware, listener, your feedback reflects that level of understanding and education. So this week's feedback comes in the form of grandma's dentures. So I guess one thing we want to remember about grandma's dentures is that she needs them back before she wakes up in the morning. Okay?
No, she don't.
Okay. Well, two schools of thought on this one, I guess. What's your explanation for this then? How do you?
My explanation is that if she wants her teeth so bad, then she should have them. But I have them, so.
Well, because you broke into her house. She's not even your grandma. She's a listener's grandma.
I know. That's what I'm saying. She clearly doesn't need it as much as us. It was sent to us.
Yeah, well.
Our listener heard us talk, said, your teeth is messed up, Dr. London. Your teeth is messed up. Replace it with these. My grandmother has really nice teeth. And our listener was kind enough to send that in. And here you are. You're trying to re-gift the gift. You want to give it back to the grandma.
Well, yeah, and I get that this is one of those you aren't supposed to re-gift gifts, but this one in particular, because grandmas, the reason why I said they need their teeth when they wake up in the morning is because they have to wake up and go chomp chomp chomp. If they have carrots, they have to chomp carrot. If they have omelet, they have to chomp omelet. And they can't chomp without chompers. And sure, most grandmas have a separate set.
I think maybe people are getting confused here. Grandma is a horse. I think maybe people were maybe thinking it was a literal grandmother.
Oh, no, did that come across that way?
I just wanted to clarify. You never know with some of our listeners. Again, they can't read or write or anything. So they might not be understanding that, oh yeah, when... chomp, 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 carrot, omelet, we're talking about our horse.
Yeah,
grandma.
The horse. Yeah, the podcast horse grandma. So,
our
grandma's
listeners stole dentures from and then sent it to us, and I'm happy with it.
And I think we need to return these dentures to our horse, in part because our horse is honestly, I want to say more well-spoken than most of our listeners. But only with the dentures. I think like there's a lot of it's gummy. They speak with their gums more. Yeah. They meaning grandma.
To be honest though,
without the dentures.
When grandma can communicate well, it kind of seems like he's always shooting us down. Like he's always voting nay.
I guess I thought that's just constructive criticism though. Like that seemed.
Then offer something. Don't just say nay, nay, nay.
I guess grandma, he is a little negative.
Let's keep the teeth. Let's keep the teeth.
Well,
I want them. I want to use them.
I know you want them. You've always been jealous of grandma's teeth.
Give me.
Every time you're talking to grandma, you'll offer for the teeth. You'll say, give you a bag of sand. Give you a bag of sand.
And what does he say?
He says, nay. Yeah. And you're like, God.
Pisses me off.
Okay, well, I guess to this listener who managed to get grandma's teeth away from him, which also is an impressive feat because grandma's fiercely protective and has night horse mares. And they're the night terrors as well, night horse terrors, which involve a lot more galloping than the usual type.
Wait a second. You're right. How a stranger wouldn't be able to safely and successfully get grandma's teeth without being chomped themselves. This was an inside job.
You think you did it?
I don't know. I can't ever be sure.
Yeah, because you try not to remember any memory, nostalgia especially, that comes up. You try to suppress it pretty hard, you've said.
Oh, nostalgia. Yeah, everyone's, the past, the 50s, the 60s, the 70s. I'm looking forward.
Yeah.
I don't have memories.
Yeah. You don't look back. If you start to look back, you'll shock yourself.
I start moving back.
Yeah. You'll usually, you have that taser in your hand. You'll usually shock yourself in the neck or possibly the head just to make sure you stay on task.
And it sucks. It hurts like hell.
Yeah, and you hate it, but like I kind of follow the reasoning, but so I guess to this listener who I guess might be you, Cameron, thank you for listening. Thank you for that feedback of grandma's dentures.
Yeah, no problem. You're welcome.
Yeah. Now for today's medical topic, hyperparathyroidism. Hyperparathyroidism is an elevation of the parathyroid hormone, which is usually abbreviated PTH, and that's a hormone that causes calcium levels to increase in the bloodstream. So the parathyroid hormone, PTH, gets its name because the parathyroid gland is located close to the thyroid gland. So it's the term para coming from the Greek for beside.
Well, and that you should specify, that's scientists' best guess. We don't know for sure where every little body part is. You know what I mean? We don't have that technology.
Well, I mean, in this specific instance, you're kind of right, because the parathyroid gland can be, if it ever needs to be resected, with surgery, then sometimes they'll take part of the thyroid. Or if they're going for a thyroidectomy, that's more common, they might take part of the parathyroid.
Could be in your foot. Could be in your foot. Well, and this is one of those things that you're never going to know for sure.
Well, see, these are pretty consistently in the neck or close to the neck.
So it's very rare to like foot
glands.
or maybe like upper thigh or lower thigh or maybe knee or back of knee or anything like that. Must be really rare. That's very interesting.
This is something where I can't say definitively it's never happened because I haven't, but I have not heard of a documented case of that being.
You think it's on the hush hush? You think it's been suppressed?
Well, or just like
they don't want people to know these sort of bigger secrets.
This does make me think, like, whenever you join my class this next semester, we might have to change that dynamic a little bit, because as you know, for all of our listeners who aren't aware, I'm teaching these lectures in a class normally, and I practice with the podcast. So, and Cameron practices being a student. That's what his role is here.
Yeah, teacher.
Yeah,
that's why every episode you hear me hundreds of times saying teacher.
Yeah, and why I've hundreds of times said please stop. It's professor for one thing, or doctor is the term you'd use for me.
Who, me? I would never use that word for you. I've never called you.
No, I know you've never have, and that's okay. So primary hyperparathyroidism. It's most commonly from a solitary adenoma, and less commonly it can be from hyperplasia of all four parathyroid glands, and rarely it can be from a parathyroid malignancy or a cancer. Primary hyperparathyroidism often presents as an asymptomatic elevation in calcium levels found on routine blood testing. As I said, PTH, parathyroid hormone, makes calcium levels rise in the blood. When there are symptoms, it can occasionally present with signs of acute severe hypercalcemia, such as confusion, stupor, lethargy, constipation, cardiovascular symptoms such as short QT and hypertension. They can have bone lesions through osteoporosis from PTH actually causes the calcium to be kind of leached out of the bones.
Well, and this sort of goes back to us talking about tenet, because a lot of people realize they had this disease because they were like, I feel stupid, I'm in a stupor, I'm so confused. and it
And that
turned out they
movie-
had the whatever in their foot or whatever.
And that's the time travel scuba diving movie was related to that.
Yeah, the Christopher Nolan time
Yeah, no,
travel.
I get that it was
scuba
Christopher
diving movie.
Nolan. That's
Yeah. I'm saying they were confused. Though you said that's one of the symptoms is like being super confused and being like an
super
idiot.
confusion. Yeah. They can also have diabetes insipidus, but I guess more often for hyperparathyroidism, there are slower manifestations such as you can still osteoporosis, nephrolithiasis. That's also known as kidney stones. They can have renal insufficiency, they can have muscle weakness, anorexia, nausea, vomiting, abdominal pain, and peptic ulcer disease because that calcium, that increased calcium, it stimulates gastrin, which causes stomach acid to be secreted. So, So besides high calcium and PTH levels, you will also find a low phosphate level, a high chloride level, EKG with short QT, and sometimes an elevated BUN and creatinine. Alkaline phosphatase may also be elevated because of the effect of PTH on bone. It raises whenever it's leaching that calcium out of the bone. Are you following, Cameron?
Who? This is
Producer Cameron.
Yeah, teacher. Hello, teacher.
No, it's doctor or professor.
Teacher, I have a question.
Yeah.
What is this?
That's your hand.
Okay, and it's supposed to like pop like that? It goes like.
No, that's your mouth that's making the popping sound. The hand is just moving. But you can put it down. You can go ahead and put that down.
Okay.
Put your hand in your lap and just so Cameron, we are gonna this is gonna be the class next week. I think is when the class starts.
Yeah,
So
it
maybe-
starts on Monday, right at midnight.
Yeah. So just I don't know. Maybe work on toning it down a little bit. Just because they're gonna other.
You want me to
students-
get toned up? You're saying
No.
You're saying
no.
I'm getting a little pudgy. Okay, that's fair. Hey, Doc, that's fair.
Okay. Well, I guess that's not a bad thing to work. But so
It's
treatment.
rude to just blast that to millions of people on the podcast like this, but
So treatment
Just
for hyperparathyroidism
fat.
is surgical removal of the involved parathyroid glands. Indications for removal of parathyroid glands, it includes bone disease such as osteoporosis, the renal involvement including kidney stones, the patient being over the age of 50, and a calcium level consistently 1 point above normal.
Yep.
When surgery is not possible, you'll give cinacalcet, and
Nothing you can do. No surgery. Nothing you can do.
okay.
It's over.
When it's not possible, then you give cinacalcet, and that'll inhibit the release of PTH. Atelcalcetide may also be used for secondary hyperparathyroidism. So, anyway, those
And
are
of course, as we always say every single week, Dr. Len is just sort of making all this stuff up. It's just a way to steal money from you. All of this is an unknowable science that really only God can know. So to even try to guess like where the blood goes and like where your appendix is and that kind of stuff is sort of spitting in the face of our Lord and Savior and Creator.
you talking about Trump?
Yes.
So thank you. And for listening, and again, just Dr. Lennon, it's sort of a stream of consciousness. He's sort of making it up as he goes along.
You refer to my lectures as the ultimate riff.
Yeah.
Yeah.
It's like jazz, baby. You're just sort of saying blood goes there and proteins over there.
That's hyperparathyroidism. But I guess we can work on, I don't know, maybe we can move on from that. And, well, I guess first let's focus on the arts and crafts portion, because I'm guessing that's what you're most concerned with, since that's your job for the class. What do you have for us?
Yeah, I mean, we can start with that. So, as you know, 1 day a week in your class is Arts and Crafts Day. This year, I made sure that it's all related to medicine. It's no dinosaurs, no celebrities or anything like that. It's all
your previous ones were cardboard cutouts of dinosaurs that were from the latest Jurassic World movie.
Which at the time, I was really supportive of, but now that the dinosaurs have broken out yet again and continue to hurt and kill more people, it's not something I can continue to support.
You're starting to see it. Yeah, you see it as a flaw. Like maybe they should find a new. Well, if they did a new system or found a new island, maybe.
I don't know. I don't know what the solution is. I think maybe it's time to scale back at least. That's all.
Well, I don't want to make this about that, but what do you mean by scale back? Because they have to do it large scale in order to get the funding.
No. They have scales on their back. They're dinosaurs.
Okay. Well, I don't know if all of them do.
And I think we don't have the moisturizer to keep those scales nice and healthy.
Okay, yeah. Most of whenever you protested, and I don't remember where you went to protest these movies, but when you did go to protest, you basically just had a bunch of moisturizer that you were carrying with you, and you were holding bottles up and saying, moisturize the dinosaurs.
Finally, can someone do it, please? Have you seen how dry and cracked their skin is?
Yeah. And
it's inhumane.
Well, because they're not humans, they're dinosaurs. I'm sorry. So dinosaurs are different from humans. Homo sapien versus, whichever dinosaur.
Oh no, I'm just gonna let you keep talking, and I don't have to say it. I'm just gonna let you embarrass yourself. Keep saying it.
They're just not the same.
No, I'm not pushing back. Listeners are gonna clip this, and it's gonna go viral on Twitch and stuff.
A triceratops, for instance, is not a human.
Go ahead, keep saying it.
A velociraptor.
Double down, triple down, people. I mean, wow.
Tyrannosaurus Rex is not Homo sapien. They're different things.
So maybe we don't even have to prepare for your class because you're probably going to get fired once this kind of stuff leaks and goes viral.
Well, I'm not going to talk about this for the whole lecture. Like it is a decent chunk of my lecture, but
arts and crafts this year. So for the fall semester, we're going to be working on a paper mache dead homeless man. And so there's going to be some of the typical...
Dead from what cause? Or is that up to the students?
Yeah, that's part of the mystery.
Okay.
It's a mystery.
Okay. They're making it. Oh, it's a mystery for everyone else in the class and sort of a show and tell situation, a project?
It's just sort of like the whole thing is just sort of this huge ass mystery that there's a lot of moving pieces, a lot of people disappearing, a lot of...
You're moving the pieces. So I guess I'm trying to find out from you, since we're going to be the ones implementing this. What are these moving pieces? Because you say it like it's vague and unknowable almost from your perspective, even though you're the one heading it up.
Well, yeah, I mean, it's like medicine. It's not anything you can actually genuinely know. It's only something you can sort of grasp at and guess at, and so it's a vibe almost.
You're grasping at and guessing at the reason, the cause of death for the paper mache homeless deceased person.
That's part of the mystery.
Yeah. Okay. And so so they're gonna make that person.
Yeah, and then I guess they'll get an A. And then
that's all. Oh, so that's all of it.
That's most of the fall semester. I think maybe also near Christmas time we can talk about doing some snowflakes, because even though it's not technically related to medicine, snow is often involved in medical things, such as freeze bite, when your fingers get frozen. And so that's a snowflake. And so that is medicine or related to medicine. And I think we could do some like paper snowflakes closer to Christmas, closer at the end of the semester. But yeah, arts and crafts, done.
With those
but what is the subject of your class, by the way?
Yeah, it's medical, and it's a question mark at the end of that word.
Oh, yes.
Yeah. So I teach and this is 101. So we're going to say pretty basic.
Yeah.
Like so I guess I won't start with hyperparathyroidism, obviously. That's too soon.
Maybe a little too complex. Anything on this podcast probably a little too complex. I mean, so you're dealing with first year medical students, or are you dealing with like undergrads?
No, this is an elective class.
Oh, okay.
For the community, yeah.
Oh, okay.
So the community center, they have a few classes that they do. One of them's like they have some like marital stuff. Some of them are helping you with learning languages.
Yeah.
And mine's medical. Medical?
Gotcha.
Sorry.
I've always wondered, why do we go up there at night? Why are the people here sort of a random spattering of ages?
Yeah. Well, you've found plenty to do in there, right? Like you started the marbles tournament, playing with marbles.
Well, sure, that was a big part of the arts and craft last year was these marbles.
Building marbles, yeah.
Well, yeah.
And well, I like the tournaments that I know, I guess your focus, it's like when people build Legos, they, some people focus on building, some focus on kind of playing more. And you were more about the building the marbles, whereas other people effectively went to war with the marbles.
Yeah, and that was why we don't do that. That's not why we don't play with those things. They're just to look at.
Okay, yeah. So, okay. I guess I'm butting into something I shouldn't have.
Why are we talking about it? We already figured out my arts and crafts. We got to figure out your actual syllabus. Like, what are you teaching the first month of class, Dr. London?
Yeah, so...
it's got to be really basic, and the community has to be able to understand it.
Yeah, I guess we could focus on venomous snake bites. For those, you're going to want to avoid those. What else is there? But human bites as well.
That's the class?
Well, like...
It's just bites?
I'm going to have pictures.
Oh, ooh. Yeah. Maybe focusing on bites for the first month. Because I have... Remembering back now, a lot of our students have had a lot of bites on their body. And I think it would be really important for them to learn this kind of stuff.
Well, just because they aren't learning it anywhere
human bite
else.
looks like infections caused by a human bite, dog bite. You can go through
and that's actually the
horse bite, whatever.
So those are all you actually treat them the same way, like with disgust and also with some antibiotics.
Yeah, and that's something you can teach your class. Is that you know?
Yeah,
but that's like, is that 4 weeks of?
Yeah, and the class is every day as well. It's for
of course,
for a few hours every day. And then there's a lunch break in between.
It's these sort of community college.
Well, it's community center. Like I wouldn't
community center. Yeah, sort of unaccredited courses or whatever we should call them. It is run sort of like a kindergarten where you have the teacher every single day, all day.
Yeah. Yeah, and just for hours.
But this is at night, so it's just from like 7 to midnight.
Yeah, and when I said there's a lunch break, that's just because we have a very late lunch.
It's still called lunch, yeah. It's just that
it's just super
like 10:30.
late.
Yeah. PM.
Yeah. So we that's, let's see. I had written out some of my curriculum. I guess let me look at last year's curriculum that I did.
Do y'all have labs? I mean, are they getting interactive with anything?
Yeah, lots of Labradors. People do bring their dogs, but like I don't encourage it.
Yeah. Well, because you don't want to dissect something that like someone loves, you know?
Yeah, or that's walking around because it's hard to catch them. Some of these dogs struggle, so I don't want to be the one to do the deed. Not in that setting. Now, if they want to bring their dog with me after class, we can figure something out.
Kind of dissect it together, yeah.
Yeah, and that's more office hours kind of thing. Not that I don't have an office at the community center. It's out of my car, but
yeah, you're like the Lincoln lawyer.
Yeah, or Lincoln Logs.
Yeah, you're just like Lincoln Logs.
Yeah. So anyway, but going by like my last year's syllabus, puppetry was a big part of it because it was remote learning. And
for sure, yeah.
You have this fixed space within which to work, and I thought like we can do not just sock puppets, we can do marionettes, we can do shadow puppets.
Oh yeah, really sort of expand the expectations of a puppet show.
Yeah. The downside,
and what it even means to be a puppet.
Mm-hmm. Oh, and believe me, that philosophy was addressed. Yeah. Yeah. In all of it, but I am finding without the remote aspect, I don't feel like my puppetry is going to be as impressive.
Yeah, probably not. So what is sort of the in-person version of puppetry?
I haven't been around people in a long time.
I mean, is it just sort of like spinning around, flailing your arms around?
So, depends on the puppet, honestly. Like, and I hate to get into the philosophy of it.
No puppet. We're in person at this point. This is you just sort of spending maybe 5 minutes at the top of class.
Well, that's what I'm
just sort
saying.
of spinning around and flailing.
If you're wondering,
which is maybe sort of the in-person equivalent of a puppet
I know,
show.
but if you're saying if this is the in-person equivalent, if you're trying to make an equivalent to puppetry is expansive. To simplify it to me spinning around, I mean, some of my puppets maybe for a few minutes will do that, but that's
your
not
issue. Is there's not enough money involved. It's not expensive enough.
There's, I mean, yeah, it's going to require some funding, so I can't. Yeah, spinning around's out. That's too much.
Okay.
But I need to. Okay, so puppetry's out as well because it's not remote. I guess I should bring out some beakers. People love that for science.
Oh, you're to play music with, right? Going hoo hoo, like blowing in them.
Yes, and also to be like me. Yeah, yeah.
Yes.
But once again, I don't know if that puppetry will.
Yeah, you keep going back to the puppet stuff. I think maybe that's the wrong avenue to go down.
Yeah.
Have you thought about maybe?
I just don't know how to teach without a puppet. I guess is to some extent.
Have you thought about poetry? It's not quite puppetry, but they do share a few letters.
Yeah.
And have you thought about maybe doing some of your medical lessons? Maybe this is week 3. You're talking about you're on to horse bites, pig bites. Really, bites of the farm is the theme of the day.
Yeah, which once again, all treated the same way. You treat them all the same way. But yeah.
But I don't. You keep telling me this stuff. Yeah, I can't wait for you to tell your students that. I don't know why.
Yeah.
I'm not here to learn. So
it will be fun to play videos of people just getting bit by all these creatures.
And is there a interactive portion to that as well? Like maybe a lab, maybe the lab bites one of the students.
Yeah, if people bring their labs to the black lab, whatever, the Labrador Retrievers, if they bring their dogs to class,
could be golden. It's it's fine. It doesn't have to be a specific Labrador.
Yeah. If they do that, if they bring their dogs, the thing is, I guess I can't hold them to that expectation. That's one thing I learned from teaching at these community centers is that some people will refuse to bring a violent animal to class.
No. Yeah.
So. It's just, and it's one of these things where like you just have to accept your limitations in the classroom, and that's okay.
Yeah, but if you put your mind to it, then there are no limitations. So
okay, so I guess that ends up being on me a little bit.
Yeah, you screwed up.
Yeah. So, but yeah, so I guess for the first month or so, it'll be a whole lot of videos of animals biting people.
Bites. Yeah, what comes after bites that the people of our community need to know?
I guess running away.
Ingrown hairs? Is that how many weeks can you do on that?
I mean, there are a lot of videos of that. So I guess given that a lot of teachers do this, they will just put on a video and leave.
Yeah.
And given that my strategy with remote learning was pretty similar to that.
Yeah.
Like I guess I can
It was just a puppet on the floor, so it was slightly less interesting than
just
putting on Finding Nemo or something. But yeah, sure.
Oh, Finding
Nemo. The credits are the same, right?
Yeah, but there aren't any credits. Yeah,
exactly. So, it's unaccredited. So
yeah, it's a win-win. It's a perfect system.
Okay, so after ingrown hairs, what about
boils? People love to know about those and to watch those. I guess we can just do any of that skin stuff. Like dermatology is not super what I'm into, but people love it. People want to watch pimple popping videos.
Could you bring in like a guy with like a really big tumor and then you guys remove it?
I can't.
Because those get a ton of views.
Yeah. I guess we could just have a TikTok day where I just say, guys, I'm going to bring in a lot of weird stuff. And I'm going to cut a lot of things out. I'm going to put some stuff in. And you just record it.
You know what?
Put some Doja Cat behind it.
The whole class is now a YouTube channel, TikTok channel. It's a social media conglomerate, basically. That's the class. And your students are basically, like interns for this company now. like they are making merch for us and stuff like that. But you're double dipping. You're teaching a class, but you're also making some scratch on the side.
I'm educating.
Side hustle.
Yeah, I mean, all that you're saying just sounds to me like I'm educating, and that is the whole point.
Exactly.
So
yeah, it's almost all an extension of the podcast.
I hadn't thought. Okay, yes, okay. So I guess occasionally I could teach like medical lessons as well. I know we haven't really gone into that yet. Mostly we've been.
I don't think they're there for. I don't think people are really going to pay attention to that.
In a class called medical, yeah.
Medical?
Yeah, medical. Okay, I guess.
What about like the medicine of like fish or something related with fish? Like maybe if you eat bad fish, is there some medicine for that? Like can that be a week or two? Like what to do if you eat,
yeah, like if you get
like really low quality fish,
botulism toxin, things like that. Yeah.
Oh, I wasn't thinking like getting sick, just like bad, like fish that doesn't taste very good, just like bad fish.
Okay. Well, I guess so. Yeah, if we get some sort of food poisoning, sure. Or are you just saying flavor? Are you saying
Yeah, I'm just saying you don't like the fish. You don't get sick from it.
Yeah. Okay.
You're just not a fan of it.
Yeah.
And then maybe like the medical reasons behind that.
Yeah.
That can be like a week or two, I think.
Well, if we go into the medical reasons why something tastes bad or, maybe makes your stomach grumble, that is.
Which is not relevant to this.
Okay.
Yeah.
I was going to say, because anything once it gets inside and things start happening, that can be very complicated to explain.
Yeah.
So I guess
that's why it'll take probably a week or two.
Yeah. Yeah. So, yeah, so we can have that.
Then there's fall break.
When they come back from that, then I guess I can focus on everyone who hasn't been taking their meds. Can just talk about it.
Let's be realistic here. For every single year you've taught this class and you've come back from fall break, you've come back recently eloped in Vegas.
I guess.
And
it has been every year. Okay.
The next week of class we know is going to be slideshows of. It's sort of progressively every day. It's meeting each other, having the wedding, and then by Thursday it's the slideshow of like getting the annulment, and then Friday is like burning all of her stuff.
Yeah, and my stuff too, because I can't see myself being away from her.
Oh yeah, you're heartbroken.
Yeah, and yeah, but also filled with so much rage at my own heartbreak because I feel so much. So
that's why you're burning all that stuff.
Yeah. So. Is that...
So that's the week. So that's just 1 week, though. So that's just the week after coming back after fall break.
And then it's me looking for a rebound.
Yeah.
And of course, and I'm ethical about this guy. Before anyone gets any ideas, I don't dabble with the class. I don't.
Everyone in these classes is, 55 and plus, and I mean plus.
And I'm not looking for any of that. So
I just don't. I'm not sure if there's truly an ethical issue for a community center unaccredited teacher to date a student their parents' age.
And I wouldn't dare doubt that's unethical, and I wouldn't.
Yeah, I guess there's a power imbalance there, because there's not tests or anything, there's not grades, so
no, there's just the paper mache dead homeless man is most of the tangible part of the class.
Yeah,
and that's you.
So there's not really any power you can hold over them. And if anything, like it kind of seems like they have power over you because you do like wash their cars and stuff for a lot of the students. A lot of the classes you come back in and you're like, oh, I did a nice thing. If you want a tip, and you hand out like a tip jar and do that like a few times until people sort of fill it up. So if anything, it kind of seems like almost they're your boss in a way.
It feels that way too. Like the way that
I don't know why you do that to yourself.
The way they talk to me too. The way they spit on me when they walk into class.
Yeah. So again,
some of them will just push me, and they'll say, "What are you going to do about it? What are you going to do? What are you going to do?"
Okay, so honestly, it is unethical, but it's the power balance the other way. The power that the students have over you is maybe not fair to you. It's probably exploitation of.
Yeah, they're pretty.
I know we're doing snowflakes around Christmas time, but that can't be the last month. I've only got one snowflake shape I know how to do. That can maybe last 2 or 3 days. Again, we're doing 25 days a month.
Snowflakes are the hardest shapes to do. Okay.
Oh, with paper? Oh boy.
Yeah. So okay. Let's say December. Because Thanksgiving, everyone's gone for November.
Yeah.
I give them the month off. And
Is
then,
there maybe like the medicine of like elves, or is that
there
like
is, but I'm not allowed
elvish
to.
medicine? Okay.
I'm not permitted to share that. Not with the class. Not in an unaccredited setting. So what for one thing,
reindeer bites can definitely at least be a day.
yeah, and that's once again, it will be treated in the same. Like the treatment is the same,
But it's sort of a refresher. It's been all semester since they learned this stuff. So
a
reindeer
cumulative
bites.
review.
Yeah.
And I'll play for weeks on end. I will play just videos of reindeers biting people, reindeer bites over and over, and people being really horrified because it's usually kids that they bite.
Oh, and you can play Ticket to Ride.
Not in my classroom, no.
Oh,
not in my classroom. No, we're going to focus on the work. We're going to get our work done.
I know you're a stickler. You're very.
We have to keep
it's
the
Christmas
schedule.
time, just their hands are probably hurting from cutting all of those snowflakes.
They get Christmas Day off, so they can do that. Christmas Eve they have to be in class, but Christmas Day they get to have off, and they can play whatever idiot games they want. But when they're in my classroom, they're going to work. And I'm sorry if that's a problem.
No, I forget.
Sorry, not sorry, actually.
I forget how tough of a teacher you are, but it's really worth it.
Yeah. Well, we have so much to get through.
Yeah.
We have so much material to cover.
Maybe the medicine of Santa's diet. That should be like milk and cookies. He's probably got acid reflux. He's probably diabetic. Stuff like that.
Yeah. Talk about how he's on his deathbed, essentially. He's going to probably need amputation. Unless he takes his insulin like he should. And,
hopefully he does.
Whatever.
I mean, he is still eating milk and cookies, so you have to assume he is, conscious of his diabetes and.
Well, I mean, also if he only eats it once a year, that's like better than a lot of people are.
It's just that he's eating, billions and billions and billions one day a year.
But one day it's cheat day.
It is cheat day.
Well,
Christmas is the ultimate cheat day.
Maybe,
that's what my ex-wife told me.
Yeah, that's on Christmas Eve. Maybe we'll let that be the big discussion. That'll be the way we go out after we get our work done. We can have a little debate over how healthy Santa Claus is for his one cheat day every year.
Done. Semester over.
Wow, we got it.
Ding 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 ding.
All right, so that's it. Thank you to producer Cameron. Thank you to Digital in the House.
Social media. Snowflakes.
What are you gonna do about it? What are you gonna do? Everybody hates it.
Social media. Snowflakes.
What are you gonna do about it? What are you gonna do? Yeah. You are
social media. Snowflake.
Yeah.
It's okay.
Everybody hates
social media. Snowflake. Social media. Social media. Social media. Social media. Social media. Social media.
My name is Dr. LondonSmith.com, and this has been the Jock Podcast.
See ya.